of all, I'd like to introduce myself. My name is Dr. Sarah Coll. I'm an orthopaedic surgeon based in Far North Queensland. And today I have a representative from AG Physio, Adrian, who's going to talk to me a little bit about cycling, primarily, because that's probably what I'm passionate about. So that's what I like to talk about. And the format is just ask any questions at any time, butt in, you don't have to raise your hand, just say whatever you like. And if you disagree, then that's probably what I'd mostly like to hear. I've got a series of questions, and then at the end, I'll ask you to ask questions specifically. And the idea is to make it informative for GPs and allied health, and also patients if they choose to watch it on Facebook. And so obviously we're recording and we're also Facebook living. The idea is to keep the content such that a patient could potentially understand, but then also allow GPs to get something out of it.
Yep.
Any questions? Oh, good. Sounds reasonable. And it looks like there's a David joining us, which I presume is David Alva. Oh, he's telling you. Yeah, there he is. Thanks, David.
There you go.
I heard why you're not here. Very, very reasonable. Okay, so Adrian, who are you?
Well, I'm a senior physio and a cyclist. Been cycling for longer than I've been a physio. Competing in cycling for probably 10 years. Some of those years were at a reasonably high level, and then that's really helped me in my physio practice because I now end up seeing a lot of cyclists, hence why I suppose I'm here today to talk about cycling.
So I'll jump a little bit to my subsequent question. When you say you compete, most people don't really understand what that means to a cyclist. Are you able to sort of describe what sort of distances you compete over and what the level of fitness is that your competitors have?
Yeah, okay. So road cycling is the main type of cycling that I do, but it also includes a little bit of gravel cycling these days as well. But competitions in Cairns tend to be a bit shorter. They can be anywhere between 80 to 100 kilometers. And the shorter races that can be 45 minutes tend to be quite fast. Sometimes patients are quite surprised to learn that the speeds that cyclists can ride at, and sometimes during races it's averaging 45, 50 kilometers an hour, but can be in excess of 50, 65. So that gives you an idea of the crashes that can happen as well during cycling. But the distances you're looking at 2.5 to 3 hours for a long race. In a professional level, that's much higher, of course, can be onwards of 5, 6, 8 hours. But amateur races tend to be a bit shorter. In terms of how fit are these guys, well, most of them have jobs like myself, so training is a side project. But let me tell you that some of them are quite fit. These days, you might be doing VO2 max tests because a lot of cyclists or who amateurs, they want to know how fit they are, and they're happy to pay money to go to science laboratories and get their VO2 max tested. And you can get some amateurs in the VO2 max of 75 to 80. Yeah, and they're just genetically exceptional in that way and have found a sport that they excel at. But for your average Joe like myself, probably 65 to 70 would be kind of in that ballpark of where we sit. So compared to an average, that's a bit high, but it's not high enough to make you good enough at the sport to be on a national level. Yeah. So.
And how many hours a week would most people be training if they wanted to compete in the 100K, sort of 80 to 100 Ks?
Yeah, so you might have to put in anywhere between 8 to 12 hours a week. What you tend to find is that most people who are training more than 12 hours a week and working a full-time job are burning the candle at both ends, and something has to give. So you don't usually see people surpass that 12 hours, but I'd say anywhere between 8 and 12 hours is reasonable. So, for example, a lot of triathletes will be doing Ironman at this time of year. We'll be working up toward that 12-hour mark at the moment. And incidentally, that's where you see a lot of niggles and injuries come through, because they are, like I said, they're starting to push the envelope to the point where they cannot recover quicker or quick enough from the exercise they're doing. So they're starting to get injuries because having a full-time job and kids lifestyle means that your recovery capacity is somewhat limited.
Yeah. Yeah, it'd be good to hear about the Ironman as well. So so my second question was, where are you from?
Well, yeah, so as you can probably tell from my accent, I'm British. So my cycling and my career has kind of taken me all over the world. I've lived and raced in Dubai, New Zealand, Australia, and England, of course. So yeah, but originally British, lived in New Zealand, competed there for a number of years and worked there as well. And now here in Cairns.
Very good. I've got, my next question is, what do you do here? But obviously you've told us you're a senior physio. So maybe a little bit more into your work that you do here and a little bit more into the cycling that you do now.
Yeah. So as a physio, and I appreciate we've got some exercise physiologists here in the house, so that's good. My first degree was in exercise physiology, and that wasn't because I wanted a career in exercise physiology. I wanted to learn how to get fitter, basically. So a lot of the knowledge I've gained was for personal use, and I enjoyed working with people with injuries. So I trained as a physio and naturally have gravitated towards sports injuries, but enjoy a wide range of injuries. But these days, yeah, I'd say that I'm predominantly seeing patients that have a range of orthopedic injuries, really, in MSK practice. But a lot of my personal development these days is geared towards exercise physiology. And the crossover with that physio is huge, because often we are helping patients get back to health, fitness and lifestyle. And that information is really useful when it comes to managing patients, but also learning about physiology, how the body works. There's a lot of crossover with disease, for example, diabetes, heart disease, and so on. Understanding how basic physiology works really helps understand those conditions and pathology as well.
I tend to find that I use my orthopedic knowledge on most rides. At some point there'll be, maybe I should move my foot position, or the further the distance on the ride. On my right, gluteal sore, so therefore that must mean I'm doing too much with this foot, and I'll, push the other foot, or I find I use it a lot more than I would have. That you would think.
Yeah, well, I use the information a lot in that way as well, but I'd say the main area of research in sports science over the last 1 to 2 years has not been on how to train athletes better. It's been how to get athletes to recover better. Because what we're seeing is that cyclists are getting faster, not fatter. Well, no, they're getting faster as well. They're getting heavy. And I'll touch on that in a second. But cyclists are getting faster, as are many athletes in all disciplines. And they're not using different training principles. The thing that's improved in the last, say, 1, 2, maybe 3 years is nutrition and recovery. So hence why I said cyclists again. Fatter they are. When you look at cyclists now compared to 10 years ago, they are heavier. They're carrying more muscle mass because there's more performance with that, and they're healthier. When you look at some of the top cyclists in the world, that are competing in Tour de France maybe 10, 15 years ago, they were immensely unhealthy. They were putting themselves in a really bad place. So because of advancements in the nutrition and recovery, that's why they're getting faster these days, with a little bit of advancement in technology as well. But in terms of how I use my knowledge, now I'm sort of thinking, if I've done a workout and I'm thinking I feel quite tired, or if I'm starting a workout and I recognize I'm not fully recovered, I'll actually abandon the workout as opposed to sort of push through it.
Goodness.
And because I know I'll get more in the long run from actually focusing more on recovery. So my knowledge has really changed. My perceptions have changed. It used to be kind of work hard, go home.
What's your indicator for stopping?
Interesting. So there's a number of indicators. I'd say most of those indicators come about before you've even got on the bike. So you might look around the room and you see that the majority of people are wearing wristwatches these days. And those of you might realize that they've got the capacity to measure a really critical component called heart rate variability. Does anyone know what that is? It's the time interval between heart rate, and that's a really good indication of whether you're recovered, or whether your sympathetic nervous system is dominant or your parasympathetic. So that can be your first indication. If you've woke up the next morning, you have a glance to your watch and it's saying, well, your heart rate variability was quite low last night. Your resting heart rate was, say, 2 or 3 beats higher. That's actually a pretty big indication that you're still recovering quite a lot from the previous day's session.
So is it, if your sympathetic's too high, is that when you?
Yeah, so fundamentally, when our nervous system enters a sympathetic dominant state, your heart rate becomes more metronomic. So let's say, for example, someone's got a resting heart rate of 60 beats per minute. You might think that someone's heart would therefore beat every second, but actually that's not true. When you're rested, your heart might beat, say, 3 beats fairly quickly and then do 2 fairly slow ones. So it could be da-da, da-da, like that. And as we enter a more sympathetic dominant state where, for example, we're exercising, we're stressed, that will actually start to become more metronomic. So therefore, you can measure the time in between the beats, which is the interval, and that's the variability. So if the time in between each beat is the same, the variability is low, sympathetic nervous system is very active. If the time in between beats is variable, then you are predominantly in an autonomic nervous system.
And so which is preferable to train with?
Well, if you are training, so as soon as you begin exercise, the sympathetic nervous system becomes dominant, but we're more talking about when you're relaxed. So let's say you've done the training, you've gone home, you're resting, you're sleeping, and that night you notice that your heart rate variability was very low whilst you were sleeping. That would be a good indication that your body was very busy recovering and actually you're not fully recovered. So that would be the first sign to tell you when to maybe consider not pushing as hard. Other signs might be central nervous system fatigue. So it might feel like your legs are okay, but they're just not moving as fast as normally you'd expect. So that's a strange one because it doesn't necessarily manifest itself as a sensation of fatigue. It just feels like when you try and turn the pedals, trying to get that cadence really high, it just doesn't come up. Good example of that was this morning. I tried the intervals on the way to work and I just could not get the leg speed, and straight away told me I'm too fatigued. Yeah.
Anything else that you look for to determine if you're fatigued?
Yeah, well, that's in me personally. But other things, can be you might not sleep particularly well. But on the bike, no, it's an overall sensation of a bit of low motivation. I think today I don't particularly want to push it. Yeah.
Quite interesting.
Yeah. Which can be hard to do when you've got a coach or a workout that's specified.
Yes.
It can bring about,
have a schedule
that
they really stick to very tightly.
Triathletes, cyclists, any kind of athlete are generally going to be a type A personality. So will be quite happy to run themselves into the ground. So if they have a scheduled workout that their coach has, scheduled for them, they really want to get through it because actually, you start questioning, am I good enough? Am I fast enough? Am I going to get there if you don't actually finish the workout? So it can be quite detrimental. You have to get your head in the right place, and understanding these things can really help because you think, okay, well, this is going to be better for the long run, as in to skip the workout rather than to sort of grind through it as such.
And yeah, it's a really difficult thing to recognize, as you say. Am I just lazy or am I unmotivated because I'm physically at the limit of my capacity?
Yes.
It's a subtle.
Yeah. But like yourself, I definitely, when I'm on the bike and when I'm watching people cycling, you can't help but look at things from an orthopaedic point of view, and you're looking at people's technique and how they're pedaling. And for fairly straightforward things such as cycling, it's really one plane of movement, and even then you're locked into a plane of movement. So there's not a great deal of coordination, but actually to get a smooth pedal stroke actually does take quite a bit of practice and time. So there is a little bit of skill involved, but it's perhaps not a skill-based sport. But
the value of the skill is injury prevention.
Yes.
It's not just to make it look good on the bike.
That's right. Yep.
So do you ride much yourself at the moment?
Yeah, so I suppose in a typical week, I'll ride anywhere between 10 to 16 hours, but I'd say a lot of that is commuting. So I use bike to get pretty much everywhere. I use a bike to get to work. So that's an hour each way. So that's 2 hours a day. So you can see how that racks up very quickly. But in terms of, you know, when I have a patient who's a cyclist, I often want to try and determine how much of your time is spent training and how much of your time is spent bike riding. Bike riding is not training. Even though it's exercise, it's often at very low intensity, it's not structured, so it doesn't have the same sort of stress or recovery requirements. So for example, I might ride my bike for 16 hours a week, but only 6 hours of those are actually spent training. Yeah, where there is a specific purpose for that bike ride.
Session, yeah. And how many kilometers would you get in a week?
That could be anywhere between 280 to 400, I suppose, in a typical week. And it sounds like a lot, but really, if you think 40 kilometers a day just to get to work, a weekend ride could be 120. A morning session could be another 60. So it accumulates fairly quick. But you know, it sounds a lot, but it's yeah, it soon builds up.
Very good. Yeah. So what's the most common cycling injury that you would see in your practice?
Yeah, okay. So I would say that the most common injury, well, first I would say I'd break it into two different types. At first, you're going to have traumatic injuries, injuries where someone's come off their bike, had an incident with a car, or they might have crashed, something like that. And then you'd have injuries that fall into, I suppose, a category that we call kind of biomechanical or overuse type injuries. And they tend to be most commonly knees and backs, I would say. So on a bike, you've got 3 points of contact. You've got feet that are connected to the pedals, you've got a saddle which they're sat on, and then you've got the hands that are on the handlebars. A bike, from an ergonomic point of view, is not a great design in the sense that, you know, bikes are made and then we have to fit the bike. And then, so, you know, especially these days, because bikes are becoming more accessible, everybody wants to have the same bike that the professionals are riding. So people are buying bikes that are, you know, meant to be raced at speeds excess of 55, 60 kilometers an hour, but they just want to ride it at, you know, a leisurely pace. So they're riding a very aggressive bike. And because of that, it's getting them to adopt a position that's quite hard for them to be in. So I would say the bulk of injuries are knees and backs, but then you get a lot of other things that are related to, you know, overtraining essentially. And that's an interesting topic that I'll go into in a bit more detail in a second. But the traumatic injuries are quite interesting. I don't know about you, but I would say the AC joints and collarbone tends to bear the brunt, the main brunt.
What was it? Yeah. You're not a cyclist until you've broken at least one.
No. And a lot of people don't realize this, that most cyclists, when they fall off a bike, haven't yet got their hands off the handlebars by the time they're hitting the floor. So because it all happens so quickly, and often you're weight bearing through your arms, it's hard just to raise an arm or unclip a foot and put foot down or hand down to break the fall. So they tend to land often in the same position they were on bike before they crashed. So they'll often land on the floor, hands still on the handlebars like this. So of course, shoulder takes all of the brunt. Yeah. So of course, all of that force goes straight through the AC joints. So
the 25 to 30-year-old will break their mid shaft or clavicle, and then the 45-year-old will start breaking the lateral clavicle, and then from there on, after that, you start dislocating your AC joint. So it's just a sequential progression of weakness between the difference between bone density and ligament integrity. So it's determining which bit breaks or which bit takes the fall. But I agree with you. I think the hip takes some of the brunt of the fall, but the bone structure is slightly better. And so therefore it doesn't actually, you know, slightly stronger.
Yeah.
So therefore it doesn't break. But I have seen a chap get a acetabular fracture just from normal road, pack riding, but just down on the side and just femoral head through straight into his acetabulum. I mean, it was displaced, but it's pretty sore.
Yeah. What I did find is the low energy falls are often the worst as well. So that's where someone's actually fallen at low speed. Because when you're carrying speed, when you fall, it's the impact is distributed more gradually over a longer period of time. Yeah, you get sort of spread. Yeah. So you're going to lose more skin, your clothing gets more damaged. But when you have a very low energy fall, there's all of that impact. It would be like if you just stood up and just let yourself fall to the side. That's going to hurt more than if you almost ran and died. Yeah. Yeah. So
very important thing to think about and meditate on while you're riding. Which way should I fall off?
And I'll say as well is that cyclists, you know, if you want to build a strong, robust body, cycling is not the way to do it. And it's not uncommon for many cyclists to have issues with bone density. You know, yeah, it's a real thing.
But also you were saying they were malnourished, you know, 10, 15 years ago as well. So there might be an element of that.
Here's an interesting statistic for you then. So a Tour de France rider in today's time, so let's say Tour de France from last year, an average rider will lose 13% of their bone density across the 3 weeks because they're so depleted from 3 weeks of continuous cycling. So that's quite considerable. And that's in today's age where nutrition is significantly better. Back in sort of 10, 15 years ago, you know, it would have been in excess of like 20%. And that probably gives you an idea that if you crash in the 3rd week of the Tour de France, your risk of fracture is about 3-fold. Yeah. And that's why you see cyclists that they're fracturing wrists, and I'm talking on a professional level, their injuries are far more significant. Yeah, the speeds are higher, but I would say that also that they would be more frail than your average Joe, because the amount of cycling they're doing, it really doesn't help bone density. What I always say to a lot of my athletes is that cycling's a non-weight bearing sport, and you think, well, hang on, it's sport. How is it non-weight bearing? You sat down. Okay, so the amount of pressure you produce in the pedals is actually relatively low. In actual fact, that because bikes these days have power meters on them, which is a device attached to the pedals that can actually measure how much force you're producing on the pedal in Newton meters, and therefore give you a reading of what we call watts. If, let's pick Bradley Wiggins, who a couple of years ago broke the hour record and cycled, 1 hour for, ridiculous amount of time, distance, 55 kilometers average pace for 1 hour. And he had to produce 420 watts for 1 hour to do that. Now you think, okay, well, what does that actually equate to? Well, if you take his cadence, which was say on average 94, divided by 420, gives you around about a couple of kilos. So actually, in terms of the strength requirement to break an hour record, you need to be strong enough to stand up from a chair. So that gives you an indication the requirement for strength cycling is actually very low.
Sure.
But could you stand up from a chair continuously for an hour?
Up and down from a chair.
Yes.
Right.
Yes. So if someone said, right, you've got to squat now, and you're going to squat for 1 hour without stopping, most of us couldn't do it. It'd be too hard. So cyclists have excellent strength endurance, but their actual strength is actually very, very low. So that's why they're very prone to orthopedic injuries, particularly fractures and so on, because they don't have the muscle mass.
So are you advising them to do weight bearing exercise to counteract it, or do you advise them to do lower intensity?
Absolutely no. So more intensity would not necessarily lower intensity. No. So if someone's let's say middle-aged folk is thinking about taking up cycling to get into exercise, I would absolutely encourage that. But I'd also say that it would be a necessary component to have some kind of cross training, such as some strength training, but built in as well, because it's not going to build a strong, robust body. In actual fact, it could actually make you more frail.
Osteoporotic.
Yes. Yeah. So, and it's for the reason that cycling doesn't do anything for muscle mass, doesn't do anything for bone density. And as we know, as we get older, they're pretty critical in terms of maintaining overall health and well-being. So I would absolutely encourage certainly the aging athlete to incorporate strength and conditioning into their cycling. Yeah.
So when you say biomechanical injuries, you said back. So what do you see in backs?
Yeah. Okay. So the question I suppose we have to ask is, when someone's getting an injury from cycling, we often think, has their injury been caused by cycling, or are they actually experiencing the symptoms whilst on the bike? And I would say that the majority of injuries are the latter, where someone is actually experiencing their pain on the bike, but it's not actually caused by the bike. So to my knowledge, I've never seen a patient that's had a disc prolapse as a result of being on a bike. I've never seen a patient experience a facet joint sprain or a muscle sprain in the back as a result of being on the bike. But if someone has a pre-existing back condition that may be latent in the sense that mostly doesn't really bother them, and they hop on a bike, and after a few hours of being on the bike, or after several weeks of taking it up and trying it, they're noticing their back's getting a bit sore. Chances are it's a biomechanical issue. And what I mean by that is they are simply trying to use or put their body in a position that it doesn't have the necessary ability or strength to actually perform what they're trying to do in that position. And therefore it's going to start to cause them pain.
So do you tell them to stop?
Not at all, actually. So I think, you know, in the most part, we want to help them understand how the bike can cause that, in the sense that, you know, a bike has many adjustments. You can raise the saddle up and down, you can move bars up and down, you can make the position more comfortable. That would be the preference initially, is to see if can we actually keep them riding their bike, but make them more comfortable in doing so. And at the same time, can we run some rehab alongside that will actually, you know, address the underlying issues, such as improved mobility or strength.
So you just see facet degeneration that manifests itself? So because you wouldn't see disc prolapse, you might see a little bit of
not really.
just stiff
Yeah,
backs.
yeah. So someone, because obviously on a bike, what happens is, because your sit bones are fixed on the saddle, so there's not a great deal of room for what we would call anterior or posterior tilt of the pelvis. So in other words, the pelvis can't freely sort of move backwards or forwards. So once its position is set, it will find the most advantageous position for the bike that you're on. And it's often the bike that determines the position, not the athlete that sits on it. So for example, if you're on a bike where the position is quite aggressive, it's going to try and tip your pelvis forward a little bit. But if you're on a more recreational bike, it's going to allow your pelvis to tip backwards a little bit. So at the same time, then you're trying to reach forward to hold onto bars. So in other words, you're in almost a back stretch, sometimes for quite a long amount of time. And all the while, you're asking your back muscles along with your core to actually stabilize the pelvis. So as you're pushing down with one leg, your pelvis doesn't rock backwards. You can often see this in someone, let's say that they are fairly new to cycling, or they may have some back issues. And as they're pedaling, you can see the pelvis rocking forwards and backwards as they're pedaling. And that's because the muscles are struggling to hold the pelvis in a fixed position. And that's going to cause a lot of discomfort in the back over time, to be honest. So, and then also as well is that, you know, someone might be riding their bike for too long, you know, in the sense that let's say you're only really used to riding your bike for 3 hours, and all of a sudden you do this cycling holiday to Italy, and you're riding for 9 hours a day, and your back's starting to say, oh, this feels a bit uncomfortable. And that's not necessarily an issue, it's not necessarily an injury, it's an adaptation. Much like if you've never run a marathon before. Yeah. If you've never run a marathon, but you're quite comfortable running 10K, you're a well-seasoned runner, you're going to be pretty sore after running a marathon. It doesn't necessarily mean you've injured yourself. It's just an adaptation that your body's going through. And the preference would be to do that slowly, rather than do it all at once.
And so knee, presume you're not, so biomechanical issues, you're not saying injuries, you're saying biomechanical issues.
Yeah, I would be fairly confident in labeling a lot of cycling related problems as biomechanical issues. So I go back to saying about the requirement for strength on the bike being quite low, in the sense that, you know, we know that you only need to be strong enough to stand up from a chair to actually produce a high level of output on a bike. So if we think, you know, well, how much mechanical force does it take to actually cause a tendon to become inflamed? How much mechanical force does it take to actually tear a meniscus? Well, it's quite significant. I'm sure you'd be able to comment on that. So I don't think the forces that someone is producing on a bike are actually sufficient to tear structures and things like that.
Right.
So I wouldn't call them injuries, I'd call them biomechanical issues, in the sense that, you know, chances are if they didn't ride the bike, they'd be okay. In the sense that, let's say someone says, my knee hurts when I ride my bike. Okay, well, what's it like when you go up and down some stairs, or if you squat down? Well, it's fine. So I'd be fairly confident saying that's not an injury. But on the other hand, if someone has a knee injury where they've had a knee problem, it's been painful in day-to-day tasks, and then they try and ride a bike and it's sore, well, that's an injury, but I wouldn't call it a cycling injury. That's an injury that presents itself while on the bike, but is not necessarily related to being on the bike. And I think that's quite important to understand, because often we get patients coming in and saying, my knee hurts when I ride my bike. And we automatically assume it's a cycling related injury, but with careful questioning, you actually realize the knee's been problematic for days, weeks, months prior to them cycling. And actually that problem would be best addressed as per normal kind of rehab protocols, rather than doing something specific like trying to do a bike fit or something like that. Sure, making adjustments to the bike can be helpful, but it's not likely to fix the issue if it's an injury that's caused off the bike. Yes. Yeah.
What would you like GPs to know about cycling and cycling injuries?
Well, probably just that actually, is that if a patient's come into the practice and they're saying, well, I've got this pain when I'm riding my bike, my back is becoming sore, I'm getting numb hands or something like that, then my first line of question would be along the lines of, well, you know, do you have an existing problem with the back? Have you had issues with your neck or your knees in the past? Are we actually dealing with an old problem, or a problem that's just been latent for a while that's actually presented itself because you're doing something new, or have increased the amount of training or time you're spending on the bike? That would be the best place to start, because if it is an old problem, chances are it would be best addressed as being treated as just that, rather than specifically going at the bike. So, you know, that's per your normal stretches, back strengthening exercises and things like that. And chances are it will respond really well. And at the same time, of course, you can make adjustments to someone's bike to make it more comfortable. But I think the first part is to understand, is this injury caused by the bike, or is it an injury off the bike? And that can really help. Second to that, I'd say that if someone is experiencing an issue that they think is related to the bike, it's quite a process to kind of try and eliminate things one by one to find out what it is. So, for example, I had a patient today who was getting knee pain from riding a bike, and that was causing hip pain, tightness in the iliotibial band. And you could go down an endless sort of line of rehabbing things like that. We actually found that she was quite strong in the IT band and the hips and knee. And actually there wasn't a deficiency in strength or flexibility. It was something as simple as the pedal and the cleat interface. So many cycling bikes where the pedals clip onto the shoes and then don't move. She'd accidentally bought a pedal interface that did not allow the foot to move. So in other words, as we're pedaling, the feet will actually move a little bit through the pedal stroke, and she'd bought one accidentally that allowed for zero movement.
It's old.
Yeah. So
the older you are, the less you can do that.
So it's a simple mistake that in actual fact cost $20 to fix and took about 5 minutes to find the problem. But if you know it's a physio that perhaps doesn't understand the mechanics of a bike or biomechanics, then you could go down a long kind of rabbit hole of trying to fix the hip and so on, when really the problem wasn't on the hip. In all honesty, that would probably give 95% of cyclists hip pain.
Was it?
Saying you've had a similar occurrence?
No,
Yeah.
I'm going to ask you about it because I'm a cyclist and his physio been treating me on pretty blind man.
Yes.
And he was looking at me about the feet. No, I'm
Has a bit of
Sure.
Yeah. But it used to be that they tried very hard to get us really locked in. Is that right? Initially, like my recollection is, 20 years ago, it had to be rigid and everything had to be stable such that you could get more force.
Yep.
So what you're saying is now that it sounds like in the process of the pedal stroke, there is a little bit of movement.
Yes.
Accommodation.
Yeah. So in biomechanical terms, the stiffer something is, the better. So when we're dealing with force transfer, so for example, if I am trying to push a pedal down toward the ground to move the bike forward, then I really want that interface to be as stiff as possible so that no energy is lost into lateral movements or sliding around, things like that. So in an application, for example, where I need lots of power over a short duration of time, then that would be an appropriate type of equipment to use, such as in track cycling, for example, when you see on the TV when they're doing the velodrome, because their races are maybe only sort of, say, 30 seconds to 4 minutes long, generally, in the maximum.
So they can be locked in tight.
So they don't need to worry about biomechanical issues because they're really not pedaling long enough for it to ever become an issue. However, when you're going to be riding a bike for several hours, you actually need to sacrifice an element of efficiency for comfort. So when you look at bike fit in terms of professionals that help people fit their bikes to the individual, there's kind of three pillars of it, really. There's comfort, aerodynamic performance, and where the two meet together. So if you put yourself in a position that is so angled towards aerodynamic performance, it's going to be immensely uncomfortable. So uncomfortable that you probably couldn't finish the full Ironman because you'd be so uncomfortable. You'd want to get off the bike and never sit on it again. However, on the other side of that, if you sat on a bike that's so ridiculously comfortable, chances are it's not going to be that fast. So we have to meet somewhere in the middle. And that's what people are always trying to balance. And that's what essentially someone who fits a bike does and says, well, based on how much movement you've got at your hip or your knee, your ankle, your back, your wrists, your neck, this is actually the best position for you. But if we put you like that, you're not going to be very fast because you are catching all of the wind. And 90% of the energy used by cyclists is pushing the wind out of the way. So if you are catching wind, you're not as fast. It's the same in anything really with Formula One, for example. It's aerodynamics that make them go faster, not necessarily more torque from the engine and things like that. So it's the same in cycling. But you need to find that balance, because if you can't finish a 3-hour race because you're too uncomfortable, it's not efficient. But if you're so comfortable, you're not going fast, that's not going to work either. So bike fit often brings those together and finds the perfect balance for you. And what I would say, it's a dynamic process. So someone who's new to cycling might try and choose a position that's more comfortable, and then over a period of months and years would gradually work into a position that's more aerodynamic. And this is what I was saying earlier, is that everybody these days wants to buy the top spec bike and see the pros riding, and they naturally come in a position that's very aerodynamic and can't be made to be comfortable. Yeah, so once you've got that position, it's often very hard to undo it because things have to be cut to be measured on the bike.
What do people do wrong when they first take up cycling? Or when they decide, wake up one day and decide they're going to do an Ironman?
Yeah, so firstly, when it comes to equipment selection, is perhaps buying equipment that's too advanced for them, like I said before. So buying a bike. So in the Ironman, for example, aerodynamics are probably more of a factor. So because the race is longer, so you need to be more efficient. So therefore, the positions that they get in, that is the difference between why a triathlete rides in this position, where they're forward on the bike, versus a cyclist who will ride in this position, is because a triathlete has to ride for longer duration, therefore wind resistance becomes more of a factor. So many people who decide that they will do an Ironman or a bike ride might buy a bike and then buy equipment that their body has not yet adapted to, and they get pain and problems because of that. So that would be one. And then the second one is doing too much too soon. Now you might think, well, it's not like running, where actually if you've never run before and you take up running and you progress that running too quickly, you can actually get some really quite significant injuries. Like, for example, you can get stress fractures, you can get tendonitis, Achilles tendon problems, even meniscal issues. Yeah. That on a bike is actually quite hard to do. You'd have to be really going at it very hard every day to do that. Actually, what most people can do where they make a mistake is overtrain. So in other words, they're riding their bike for longer periods, they're doing more exercise, taking on more stress than their body can actually handle, and actually they start to experience other rather unusual symptoms like poor sleep, irritability, mood disorders, things like that. And what they're actually experiencing is kind of like a fatigue type symptom really, where they're overtrained, and it's a hormonal problem really. The body's experiencing cortisol so much of the time that they're not getting that recovery. Yeah. And but I'd say that's it. And then of course you get cyclists who are not used to riding in groups, and they might try a race and they ultimately have a crash, unfortunately. Or they might not realize that actually riding in certain weathers can be quite dangerous. A lot of people don't know that the roads get quite slippery after it's rained, and taking a corner you've always taken at the same speed will likely result in a crash. And that's where you get the trauma related injuries. Yeah.
Train tracks, our class, when Valley Biscuit, taking a train track.
Yeah, they're common.
They're a problem up here because, you know, if they're actually perpendicular and the concrete goes to the track and then goes on the other side of the track, but around here, they were made a bit ad hoc, and sometimes they run like this. Yeah, with the road, so they run along the road and then they sort of sneak across, like that. Yeah, and then over time, the gap between the track and the road widens slowly such that it'll catch a wheel, and then there's a few roads. I mean, once you've been riding a lot, you know exactly which road. And I ride very early in the morning, so no one's there, and I always try and turn to go perpendicular, even if I've got to cross to the other lane. Yeah, it's just never worth it. You know, having seen friends go down in front of you, you just never want to do it ever. But it's a particular problem up here because of the sugar trains, and it's more so than tram tracks would probably be bad. But so it's one of those things that you learn as you go along, and that's certainly.
So in terms of the injuries that professional cyclists get, I would say falls into the same category. So when I lived in England, I worked at the Manchester Velodrome as a physio, and I was one of the physios for Team Sky, which is now Team Ineos, which is like a fairly big cycling. And you'd be surprised, they're getting things like saddle sores because they're spending so long on the bike. So a saddle sore is ultimately a pressure sore or a friction of some sort if they're not on the saddle very well, or there's excessive movement. But a lot of the time they're also bacterial related. Bacteria gets into a hair follicle, causing an infection, and we get that. So again, I'd say that that's a cycling problem, but it's not so much an injury as such. That would be a common one.
Pudendal nerve injuries if their saddle's not right.
Yeah.
Pudendal nerve runs on the inner table of the issue of tuberosity. If they're straddling a saddle, they can get numbness. And they don't talk about it and they don't complain about it, but they can get quite dense numbness if they're not careful.
I would definitely say that was an issue, but in these days saddles have changed now. Yeah, so I would not say I've certainly heard many cases of that in the last 5 years. What saddles have now is the central strip that you sit on has a cutaway. So, and it's for that very reason.
It used to be shaped.
And they were awful. It caused a lot of numbness. It was uncomfortable. But studies showed that, did it affect like men's health in terms of did it cause any problems? And they found no, but still it was concerning. And then they just changed the saddles, and they kind of all went away.
I think there was a paper in the Journal of Urology eventually, as they sort of worked out to shallow out saddle. Do you treat any other particular types of athletes?
Sky athletes, runners,
as opposed to cyclists. Totally different.
So obviously, so I look after a rugby team here in Cairns with the brothers rugby, and they get typical rugby related injuries. Ruptured ligaments, shoulders, AC joint sprains. So I'd say in the last month alone, I've seen 2 ACL ruptures, MCL rupture, medial collateral ligament rupture. Trying to think of an interesting one. Found fairly recently a fairly significant pars stress fracture in a 16-year-old that had been present for 2 years. That was quite substantial.
There was something in the news, wasn't there, that is it AFL players are starting to get pars defects, and they're chasing up the Australian cricket to teach them what they were doing wrong.
Yeah, interesting. Yeah, I've not heard that, but
so what, you've got a rugby player with a pars defect?
Yes, just too much strain, too much stress over time.
Do
Really.
you know what we're talking about? Do you know which part of the body we're talking about? You said,
Oh, sorry, a
pars defect.
pars defect.
do you know what we're talking about?
Pars intraocular.
It's not coming. No, see, so that's
Yes,
important.
yeah.
So for us, go on, you're gonna have a go? Yes. Yeah, very good.
Yeah.
Yeah. Do you know what I'm talking about as an exercise physiologist? Pars defect?
Just trying to think, it's not growing confidence off the side of the vertebra.
Correct, very good. The physios know? Yeah, confident? You know what I'm talking about? Yeah.
Yeah.
It's interesting, the spectrum of
Yeah, it is. Yeah.
understand. So what he said, so the vertebral, so I'm going to talk to GPs. So the vertebral body has the little spikes out the back that surround the spinal cord. So it's got two that come out and then two that come back in, and then there's the spike out the back, which is the spine that you can palpate when you feel a spine. And so one of those we think with rotation and excessive extension of the back, they get a little stress fracture of one of those limbs, and then they become non-functional. Basically, you know, they really struggle to perform because it's a core, you know, structure of their spine. Their performance is going up and up and up, and then it just falls off a cliff because they just can't do anything. And there was a spinal surgeon in Western Australia that used to screw them, which was technically difficult because it's hard to get, you know, the orientation. Back in the day, it was before we had X-rays in theatre, three-dimensionally to try and sort of show him where to put it. Nowadays, you can do it because the computer tells you where to put the screw.
Yeah.
Right. So it's got you feed in the X-rays, and then the screen will show you where the tip of your drill bit's going.
Yeah.
Three-dimensionally. Does that make sense?
Yep.
Yeah.
Yep.
So you can because you've got to run it down a tube that's got a slightly different angles, but you can't see where it is because you only want to dissect.
It must only be 2 or 3 mil thick.
The pars variable, the lower down it gets down to 7, sort of 7 or 8. So you can usually drop a 6 or a 7 along it. But he did that for a long time, and then it was all sort of thrown into disrepute. And so now they rod them, they fuse that whole level.
Wow.
Yeah, which is disappointing because then they've got a stiff level
Yes.
in an athlete. And, you know, that's kind of the last thing you want. Otherwise, they wait it out. Presumably you're.
Yeah, well, that's it. I mean, so for the benefit of yourselves, having an adolescent, I'd say between the age of 13 through to 16, to have, you know, unilateral back pain that's been persistent for a few months is highly unusual. And the reason being is that kids just don't get back sprains, their muscles don't sprain, they don't really get disc injuries, they don't really get bulging discs or things like that. They don't really get facet joint inflammation because they're so bendy, and they recover so well anyway. So even if they did, it'd be gone after a day or two. So to kind of have a presentation of kind of unilateral back pain for more than a couple of weeks is highly unusual. Yeah.
So I think I did have a
Yes, to try and get the stress fractures to heal takes a long time.
We just follow the plan of CT every 3 months, every 8 weeks to 3 months, and once it's healed, it's healed, and that's run alongside back strengthening. But it can take 6 weeks to years.
Yeah.
If it's chronic stress fracture, very long time.
But it's also you've got to watch their activity levels, because sometimes they just don't understand what you mean by stop, you know, or what you mean by rest. And you know, when it's an Osgood ladders or something like that, I try and say modify. But when it's spinal, you know, what is there left, you know, for them to do? If, you know, what alternative can you give them? It's hard to find a non-irritating sporting activity for them.
It's a small frequent in elite young.
Yes.
Athletic, I think it's sort of the tall and skinny. Sometimes I see it in them, but it's about well, can you talk about the etiology of it? Why some people get it, some people don't?
Not really. I don't know to that
It's the
extent.
spin bowler. So it was the spin bowler, not the fast bowler. There's some sort of hyperextension of their spine, and people swimming butterfly. because they overextend their back so repeatedly, that seemed to be the mechanism. Maybe the facet joints kind of butt up against each other, and that creates a pressure, a lever arm across the
Yeah, I think the facet joints become compressed during extension. So that's commonly, I'd most commonly see it in dancers.
Yeah.
Who are bending backwards a lot. But this particular one I've seen, there is no correlation with extension because rugby's don't really do extension unless he's been picked up and driven into the floor a few times.
But it's more repetitive something.
Yeah.
I wonder if there's something that they're doing with their training before they go out, unless they're doing the front, sort of back extension.
Yeah.
Was he tall and lean?
No, not at all. He was stocky, short and stocky.
And how
Yeah.
he was tall and lean, do you remember?
Soccer was the game.
And was he tall and lean?
He's lean.
Yeah, it used to be, as you said, dancers, cricket players, but now you see less of it in cricket, probably because there's not much of it in cairns, and more in other sports. So yeah, I'm not sure about the correlation. They haven't done us fit a typical pattern of what you think would cause it. Yeah.
Gymnasts.
Yes, gymnasts, yeah, because of all the extensions, ballet in particular. Yeah.
They just do it over and over and over again. It's the repetition more than any extreme thing, like you say.
That's true. Yeah. But what other injuries do I treat? Yeah, so cycling as in, so what interesting, what injuries do triathletes get? Because they are cyclists, they cycle probably as much as as a normal cyclist, but they also do running on top. So that's a complicated bunch because they often get running related injuries, such as tendonitis issues, hip issues, and so on. That then start to affect their cycling. So they're often not sure, has this been caused on the bike or has this been caused from running? Yeah. And what you'll tend to find is this time of year is usually the typical time where you'll see most presentations from triathletes because they are ramping up their training volume. So training volume means the total number of hours they do in a week. Ideally, there is an ideal range for that. It shouldn't increase more than 4 to 6% per week. So
tiny.
it is small, isn't it? Yeah, and that's called your ramp rate. Okay.
It's tiny.
So yeah, it's quite small. So that means, let's say if you're running 10 kilometers, the following week you shouldn't be running more than 10.5 kilometers. So you can see it can take you quite a long time to go from running maybe 20-30 minutes a week to then being able to run for 2 hours consistently. And that's where you see the injuries. And then within that as well, there's meant to be structured periods where there's rest. So we call that a macro and a meso cycle. And basically during training, someone should do 3 weeks of hard and then 1 week of virtually easy recovery time. And that's where your body recovers, because remember that recovery is where your body adapts, and it's the adaptations that bring on the improvements in fitness. So if someone is not actually recovering from the exercise they're doing, they're not actually getting the intended benefit from it. So sometimes one of the biggest challenges in working with triathletes is actually getting them to do less, not more. Yeah, and convincing them that they will get fitter, stronger, and faster from doing less, not more. Yeah.
What's different about treating athletes compared to us normal?
Yeah, type A personalities, getting them not to do what they instinctively want to do. So I would say over the last 5 years, my biggest challenge with athletes has been getting them to cross train. And cross train means doing things that are not their original sport. So for example, as a cyclist, you might want them to lift weights. And you want them to lift weights to build that bone density, to build the resilience in their muscles, to build the capacity of their tendons. But they don't enjoy that. They enjoy riding their bike. And until they actually see the correlation between doing this activity and them getting better on the bike, it's a very hard sell. Okay. It's much like convincing someone to do exercise they don't want to do. And we all know what that's like. It can be hard. And then type A personality, did you tell a cyclist not to ride for 10 hours, instead do 5 hours? Instinctively, they want to do more. They'll often go and do 11 hours because...
What if you tell them to do less?
Yeah, well, no, when a cyclist sees a problem, that they see as a threat, or any athlete, when an athlete sees a problem that is a threat to their performance or to their ability to train, they'll often think the solution is to do more. So, for example, someone lost a race, and they lost a race because they're so fatigued, so tired, so overworked. And the obvious answer to that is to do less, recover, let your body relax and adapt. But they will often think, I need to do more. Okay, I'm not doing enough intensity, therefore I should do more. So type A personalities, the hard sell is to get them to do less, but more structured and more specific, and helping them understand that they will actually do better. And I can remember the first time I ever truly adopted this was after I had a child. I went from training for sort of 15, 16 hours a week to training from about 5 to 6, and I got faster. How does that figure? I got faster just through doing less. But what I was doing was very specific. It was all training, less time riding around. So sometimes, yeah, you have to provide credible evidence to them to say they will go faster. So you can't just say it, you've got to explain the physiology and why. Cyclists, everybody these days wants to know everything about everything, because they've got access to that information. Yeah, so I quite like it when someone challenges me on this, because, you know, I can quote, you know, evidence and you know, information on physiology and how it all works, and they can often relate to it. But what's the hardest thing about working with athletes is, I would say, is yeah, getting them to cross train, especially slow down and cross train. So as a triathlete, I'd say it's not as important, because triathletes already cross train. They swim, run, and ride a bike. But a cyclist, someone who only does cycling, remember, it's a one-dimensional type activity. They're pedaling in one plane of motion. There's no sideways movements. There's no rotational movement. It's not going to build a particularly robust individual. So they might get very fit on the bike. When it comes to, say, digging a hole in the yard, they might not be so good, and actually might cause themselves back injury or something like that. So cross training can take the element of that away. You can do exercises to strengthen your back, your joints, muscles, etc.
So they can look fit but not be fit.
Correct. And I would say cyclists at the top of the performance. So you take a Tour de France cyclist about to start competition at the peak of their fitness, and you ask them to dig a hole. They will not do it quicker than someone who's been doing yard work for a while. If you even ask them to go to a gym and lift weights, they'll perform terribly. If you ask them to do anything that requires any form of coordination, skill, or balance, they'll do terribly. When we do biomechanical testing with pure cyclists, they often do terribly. So this is how I know that, and because of course myself, you know, when I'm at my fittest, I'm at my weakest. So for example, I've had to turn around multiple times from doing big hikes because my quads were just completely exhausted from the walk. And that's, you might think, well, isn't cycling, doesn't make your quads really strong and fit? Absolutely not. No, it does not. So a lot of you might not think about this, but cycling contains no eccentric movement. Does anyone know what eccentric movement is? Yeah. So
Physio is real,
the way that a muscle contracts, it has a concentric component where the muscle fibers are coming together, and then an eccentric component where they're coming apart. When the muscle comes apart is when most of the microscopic damage is done to the muscle, and therefore most of the strength is built. So in cycling, because you're only ever pushing down on the pedals, there is no effectively lowering yourself or the muscle lengthening under tension. There is no eccentric component. So you can have these plump, big looking muscles that are full of mitochondria and have excellent aerobic capacity, but have very little strength. Yeah. So
This look good.
interesting. Yeah, yeah, exactly. Yeah. Yeah. So cross training is really, really important.
Any questions? We haven't got much time left, so now's your big chance. Have you got any questions? Are you ready? You ready for June? June 18?
I say that I'm finding the same thing with the strength. So I've been in and out of the gym for like 30 years. So
Yes.
been a cyclist for about the same. But casual, more some last probably 10 years, a bit more.
Yep.
More than casual. I guess I'm competitive, but not professional like that.
Yeah.
A few Ironman and stuff like that, and a few other triathlons and whatnot. And I've found, especially this year round, I haven't done one in probably 6-7 years now, and it's a team event, we've got the team back now, they're all getting back together. So just, I'm doing exactly what you said, where I only cycle to train, and it's just training only, because I don't, A, have the time with work and other stuff, and B, I find I'm too small.
Yeah.
So, when I'm in the gym, it's mainly core and upper body and lower leg mobility. And just a little bit of rehabbing stuff.
Yeah.
But I'm doing some strengthening rather than strengthening in the gym, but I find it just affects the body too much. So I'll get my strengthening on the bike with hills and stuff like that. So more specific, I guess.
Yeah. That's a bit of a I would say a myth is someone says, well, can we strength train on the bike? What if I pedal really slowly and really hard?
Put it in a hard gear and go.
Yes. So remember I was talking about we can reverse the equation. So if we have a device on a bike that can measure the power and you know the cadence, you can reverse the equation to work out how much force you're producing. And let me tell you that if you pedal at 1,000 watts, which is considered extremely high, at 60 RPM, it's still only 20 kilos of force going down on the pedal. So if you think of being in a gym on a leg press machine, pushing 20 kilos, it's difficult, but it's not significant, is it? It's not going to.
You couldn't do.
You could do it for 3 hours. No, exactly. So
repetition.
you can't strength train on a bike, but you can work the muscles under higher load like that.
But it's not the same as a gym.
It's not the same as a gym.
All right. That's good.
And it still doesn't contain the eccentric component, so there is still no mechanical damage to the muscle. All the damage is metabolic. It's through metabolic stress, none of it's mechanical, so there is no mechanical adaptation.
So Mike Mason used to say to all his needs, just get on a bike. You don't need to get on the bike.
Well, a bike is fantastic for developing range of motion at the knee and the hip. So certainly after knee replacement, hip replacement, a bike is fantastic. Yeah, for sure.
But it's not going to give you. It's not going to give you the long-term result, which you're saying is.
It's like when doctors used to say, if you got a bad back, go swimming. You know, again, it did nothing. Swimming is a non-weight bearing activity. In actual fact, when you look at the research on swimming, it compares horrifically compared to things like exercise from gym, Pilates, yoga. I mean, even mindfulness compares better than swimming. So if you've got a bad back, don't go swimming. Do some meditation. Yeah. It's even better than that.
Be mindful in the pool.
Yeah.
So the meditation in the pool as you're swimming is more effective.
It's more effective than swimming alone. Yeah.
Wow.
Yeah.
Well, thank you very much, Adrian. Thank you so much for coming and talking to us. I learned a lot. The next talk we're giving is on the 8th of June with Helen Cooper from Gordon Bale Physiotherapy. I'm sure you've probably got some questions that you're going to ask offline, so feel free to hang around and have some more cheese and crackers. I think for me, my take-home message was it's okay to rest, but being very type A, I find I have to meditate on taking that advice while riding my bike.
Yeah.
Because it just, as you know, it sounds so counterintuitive, but I was very interested in that fatigue feeling. I, routinely ignore that fatigue and just go riding anyway. But I think probably halfway through the ride, I'm just riding slower and slower and slower without sort of appreciating it. But like you say, sometimes it's just a commute anyway, so it doesn't matter. But
that's right.
I can certainly see now that cranking up the intensity rather than riding through the fatigue is probably what you're saying. Get the training in, right? Get the intensity up. When you're there, be there. And then when you're not training, rest properly.
It's the number one problem when you speak to any cycling coach and say, what is the number one problem with the way people train? And they said the hard is not hard enough and the easy is not easy enough.
Oh yeah, that's good. Yep. All right. Yeah, I'll take that to my next bike ride. Thank you very much. Thank you very much. Hi Dave. Thanks, Dave.